Hi, my name is Nadirah. I'm from Malaysia and I'm currently a Senior Humanitarian Program Officer for the International Planned Parenthood Federations or IPPF. According to the recent data from UN OCHA, currently there is around 339 million people affected by humanitarian crises and emergencies, and this number is expected to increase due to climate change effects and the rising number of conflict erupted around the world. And as you know, during an emergency response, sexual and reproductive health needs are oftentimes sidelined or ignored during the response. During an emergency or humanitarian crisis, we often see exacerbations of vulnerability related to sexual and reproductive health. Women and girls are particularly at risk of sexual violence, unwanted pregnancy, and sexually transmitted infection (STIs), including HIV. During this time, there's disruption of health service, and this lead to significant health problem. Pregnant women need continuous access to prenatal, delivery, and postnatal care to ensure health of both mothers and babies. And there's also lack of access to healthcare can result in increased maternal and infant mortality and morbidity. Let us not forget that during an emergency and humanitarian crisis, there's also increased incidence of gender-based violence or GBV. Providing SRH services, including psychosocial support, clinical management for rape survivors, and safe spaces can help prevent and respond to gender-based violence, reducing its impact on survivors. Access to family planning and contraceptions is crucial during emergency to prevent unintended pregnancy. This is particularly important as healthcare infrastructure might be compromised, making it difficult to manage pregnancy safely. On top of everything, ensuring access to SRH services during emergencies and humanitarian crises is a matter of upholding human rights and dignity. It is essential to ensure that all individuals, regardless of their circumstances and regardless of their identity, have rights to make informed choices about their reproductive health, even during an emergency and humanitarian crisis. Lastly, I want to emphasize that SRH services are life-saving and they are very crucial during an emergency and humanitarian crisis. And we need to ensure that every emergency response have component of SRH services embedded in them. And we need to continuously advocate for SRH inclusion in all the national policy and also local policy all over the world. Thank you.